How's it going, guys? We have a past level question for genitourinary. 7-year-old boy, he's got testicular torsion, and we know this because we're handing you the diagnosis here. Excruciating scrotal pain, high riding, horizontally oriented testis. It's how they can describe it. They don't have to say that. They can give you the examination findings, which I'll talk about. So what are we going to see in this patient? Choice A, blue dot sign is wrong. This is seen with torsion of appendix testis. Holy shit, it's not the same thing as torsion of testis. There's a vestigial Mullerian structure on the superior aspect of the testis that doesn't serve a role in males. And Mullerian is the paramesonephric structures, the female structures that regress. Okay, and it can become torsed for whatever reason. And torsion of appendix testis, age 7 to 14, classically, blue dot sign of the superior testis, they will tell you there is an intact cremasteric reflex. Okay, so when we talk about regular testicular torsion like we have here, we have the cremaster muscle, which if the medial thigh is palpated, you'll have retraction of the ipsilateral testis. So our correct answer is choice B, genitofemoral nerve impingement. You have what's called a bell clapper deformity. Now, normally the testis, the posterior aspect, is linked to the scrotal wall. In some patients with the bell clapper deformity, they have a free swinging testis. It's not connected to the posterior wall. So the bell clapper within a bell, okay, it can free swing and it can become torsed. So you can get torsion of the testicular artery, the pampiniform vein plexus, as well as the genital branch of the genitofemoral nerve, which mediates the efferent limb of the cremasteric reflex. So when the thigh is palpated, as I said, you have the afferent femoral branch of the genitofemoral nerve, and it's going to be mediated efferent, L1, L2, genital branch of the genitofemoral nerve back down in order to contract the cremasteric or the cremaster muscle with retraction of the ipsilateral testis. So this would be intact in torsion of appendix testis, but it's not intact. Okay, so you have a negative cremasteric reflex with torsion of testis as we have here. Now, choice E also wrong. I'll come back to C and D in a second. So a Pren sign is normal. If you have pain of the testis and epididymitis, if you lift/elevate the ipsilateral testis, the affected side, you'll have relief of pain and epididymitis. It's a positive/intact/normal Pren sign. In torsion of testis, however, you have a negative/absent Pren sign where there is failure of relief of pain of the testis with elevation. So you'd say this child here, he would have a negative Pren sign and a negative cremasteric reflex. Why D and E are both wrong here. Okay? Choice C, patent processes vaginalis wrong. This is our hydrocele mechanism. So you have in embryologic development the peritoneum that descends into the scrotum, and it is going to obliterate and ultimately leave just the tunica vaginalis enveloping the testis. But if you have failure of obliteration of the processus vaginalis, you can get benign serous fluid enter the testis, hydrocele. It transilluminates. When you shine a light on it, you're going to have passage of the light, so it appears to glow red. The USMLE merely wants you to know that embryologic mechanism, and you do not do surgery before the age of 1. Most will self-resolve for hydrocele. Patent processus vaginalis? Wrong fucking answer.